welcome to the Psychiatry and Psychotherapy podcast. I'm here to talk about getting rid of burnout, increasing job satisfaction, and feeling like an expert in what you do. One thing that created a lot of burnout and angst for me was trying to get continued medical education right at the last minute. So why not join the CME membership and do CME while listening to this podcast? Go to psychiatrypodcast.com, sign up, sign in, take the test, and the certification is emailed to you in seconds. All right, welcome to the Psychiatry and Psychotherapy podcast. I am joined today by none other than Matt Reynolds. He is an elite level strength training coach. He was a strongman, professional status. He founded one of the most successful online strength training programs, Barbell Logic. He is the host of Barbell Logic podcast, which has about 150,000 listeners per month. And he is my strength coach, actually, and has been my strength coach for a while. And what that means is that whenever I do my squats, deadlifts, rowing, any of that stuff, I video the last set, I put it up, and he comments on it. And I've done some leadership development coaching for him, so we've become friends. And I'm also joined today with Kyle Logan. He's a fourth-year medical student who has been working on a project looking at the effects of strength. So, guys, welcome to the podcast.
Thanks for having me, man. I'm excited.
Thanks.
You've been on my podcast 3 or 4 times now.
I know. The reason why I wanted to bring you on, Matt, is because I have had a lot of success with a couple of my clients who have actually followed through with getting a strength coach. And I'm looking at the data from the last 2 years of these studies that have come out. So we specifically said, let's only look at the studies that have come out in the last couple of years. And let's look at the big meta-analyses and let's try to figure out like what is the best exercise for people with depression, for people with psychiatric issues. And it was strength training and high-intensity interval training.
Yeah. And
so I thought, hey, let's go through a little bit of that data, not in a way that's going to bog people down, but just to kind of convince them. And then let's get Matt Reynolds on and talk about like the process of getting strong, because there's a science here, and it's like I've become aware of it in the last couple of years working with you, listening to your podcast, but I don't think a lot of people really understand this. And so I really wanted to talk about how to go from zero, like you're doing literally nothing. Like I have this one patient that I recently got going. She stays in bed most of the day. And so how to go from there to like in maybe the 95th percentile of your age group for strength, which I think it may be a couple year journey, but I think it's a worthwhile journey.
Sure.
And I think it's going to help people with their depression, with their mood issues. So, we're speaking in this podcast to therapists, we're speaking to psychiatrists, people who are medical students, people coming up in training. And, I imagine patients are going to jump on and want to know, what's the best program for me as well? So.
Yeah, all good. I think it's interesting because we can bring kind of both sides of the spectrum there, that certainly we like the data and we like the science at Barbell Logic, but the real advantage I think that we bring to the table is that I don't believe there's anybody ever who has strength coached more people than us in history. We've coached thousands and thousands and thousands of people specifically for strength and this high intensity interval style conditioning that you're talking about. And so while the data absolutely matters, hopefully what I can bring to the table today is the experience as well. Say, look, no one has tested more people in this exact realm than the coaches at Barbell Logic.
Yeah. And, it's, I feel it's a huge privilege to also be coached by you, because I know you've been doing this for like literally your whole adult life, and you're at the top of the game. You were one of the top power lifters, strongmen, and you're still incredibly strong. So you've lived the life, right? So you're not just like a physical therapist who's gonna, try to help people get strong who have never really done it themselves. And yet you have this incredible now amount of experience in trying to help people get past roadblocks. You've helped me get past a bunch of roadblocks for myself. Like, so just to give people an idea, before I started working with Matt in, I think it was January. So it's been about 9 months now. Before that, I had been basically trying to do this all myself. I had been to a couple conferences, strength training conferences. I had, some friends who were into it, so we would kind of coach each other, but I had never gotten past certain roadblocks. I had gotten stuck in my lifting kind of around the same numbers. And it's been really interesting and surprising actually to see how you kind of like sequentially have helped me push past certain strength, kind of like mental blocks and roadblocks. Because there's a psychological piece and there's a physical piece going on.
Yeah, absolutely. What I hope we can delve into just a little bit in the show today is it's really not that complicated. And I think maybe that's really one of the biggest pieces, right? People have some fear about doing it in the first place. They don't know where to start. The fitness world, especially the one that we see on Instagram, is rife with misinformation and people who are focused entirely on aesthetics or taking pictures of themselves in the mirror in scantily clad clothing. And there is a select few people out there who are strength training really for health and for quality of life improvement. And when that is the focus, it actually isn't that complicated. So I hope we can dive into that a little bit. You talk about some of the changes we've made. They're just very simple, minimum effective dose changes, much like what you would do with your patients with prescription medication you would give them. You don't change a million things at once. You just, you change a tiny thing. Mm-hmm. And we do the same thing in strength training. So hopefully we can find that common ground there.
Yeah. So Kyle, I want you to kind of answer this question here. So from the data, I think what we found is that the most recent articles show that increases in strength have the biggest impact on depression. So we're going to talk about that. So tell me about the studies for that, Kyle, real quick.
So as Dr. Peter was saying, this is research over the last 2 years, and we have a couple articles right here. There's a large meta-analysis, 33 randomized controlled trials, kind of the top level of research, 1,877 patients. They were found to have resistance training to have a mean effect size of 0.66 on reducing depressive symptoms. And another interesting thing in the study was the number needed to treat was 4 to have one patient enter remission.
And just to give, so an effect size of 0.66, Matt, what that means is like, imagine like a bell curve of depression.
Sure.
And you're going to move people 0.66 standard deviations from where they started.
Right.
That's 33 randomized controlled trials, 1,877 patients. So that's a lot of people that they looked at. And that effect size change, that is pretty similar to what we would see with medication or psychotherapy. So I literally tell people, look, strength training is going to be as good as one antidepressant.
That's right.
And it's going to be part of the overall picture because people don't just need to move 0.66 standard deviations. Usually they need to move around 2 or 3 to get back to normal. So it's like part of the package of what I give people. Okay. Tell me about this other meta-analysis.
So another meta-analysis involving 27 randomized controlled trials with 1,452 clinically depressed adults revealed an effect size of 0.96 for strength training and an effect size of 0.52 for endurance training on decreasing depressive symptoms. And when you only counted endurance training lasting longer than 10 minutes, the effect size increased to 0.62.
Yeah, so what this basically showed was that there is a stronger effect size, meaning more standard deviations of movement away from depression in the people who did just strength training. And compared to just cardio, running. Right. So compared to just going out there, going for a jog, this is much more effective.
What most people do when they start, because that's all they know how to do, right, is to just jog around the neighborhood, which is not a bad move. If that's all you know, it's still a starting point. I would never put down a person who's trying to do something. But the studies have clearly shown that if instead if you had to choose between one, if you had to choose between two, you had to choose one. Strength training is going to give you the best bang for your buck.
Yeah. Okay, go over this next one, randomized controlled trial of of youth. So now we're talking about 15 to 25-year-olds. And specifically, I think this one's important because right now, in the midst of the pandemic, there is an epidemic within the youth of suicidal thoughts. I think something like 20% of people in this age group have had at least one suicidal thought in the last month. 20%.
So this trial on 68 youths, age 15 to 25, meeting MDD criteria, were assigned to either resistance training or high-intensity interval training for 12 weeks. After this 12 weeks, no significant association was found between strength and aerobic exercise attendance, but there was a dose-dependent change relationship between increases in the YMCA bench press test and decreases in depression severity with an effect size of 0.51.
So basically, half a standard deviation better decrease in depression if they got a much better bench press.
Yeah. If they got markedly stronger, there's clear correlation with a decline in depression, right?
That's really cool because it's like, okay, then the question is, how do we get them the strongest, the fastest?
Yeah.
That becomes like what we're really aiming at. Okay, we want a program that can get people stronger, that can get whatever they're lifting, squatting, benching, deadlifting. We want to get that strength up the fastest we possibly can because that's going to make the biggest impact.
Absolutely. Do you want me to tell them how to do that, or do you want to hold off?
Hold on for a second. We're going to get there. That's like
I'm like the guy. I'm like sitting on the chair, and I've got my hands underneath the seat, and I'm like shaking because I'm like I can't wait to tell. I want to tell people, man. Let me
tell people.
Take the bridle off. Let me tell them. Let me tell them how to do it. But no, I'll wait. Okay, we'll keep
we're going to build it. We're going to build it up.
Tease for a while. All right.
Well, let's do it. Doctors are only convinced if you show them some data, right?
Yeah, give me the data first. Okay, now let's move it to practical. Okay, got it.
So talk about this study, this cohort study of around 6,000 Chinese participants and what they found with hand grip strength.
So in this cohort study of 6,392 adult Chinese participants, they found the incidence of depressive symptoms was higher in populations with lower hand grip strength. And the incidence of depression was 11.9, 15.5, and 22.1 for the strong, moderate, and weak hand grip strength group, respectively. So there were almost twice as many depressed patients in the weak hand grip strength group compared to the strong group.
Yeah, and so what this really points at is there's something about being strong that decreases the incidence of future depression. So I tell my patients, look, get strong and you'll be less likely to have this level of misery again in your life.
And the authors also did a meta-analysis with this study and 5 other studies across different countries. I think one was in the UK, one was in Germany. And so the total number of patients was 26,473. And they also found a significantly decreased risk of depressant symptoms among participants with strong hand grip strength, having a relative risk of 0.74.
0.74, that's significant. So just even the hand grip strength, Matt, I don't know if you've heard of this type of study, made an impact.
Well, and this isn't a study, right, that you put someone on an exercise program. This is looking at people who are already strong, moderate, or weak. So when you look at somebody who is strong, when I think of, we're talking about over 26,000 participants and a very detailed study of over 6,000 Chinese adult participants, right? When someone has strong hands, what do you think about? I actually don't think about weightlifting necessarily. Practically, what do you think about?
What do I think about? I think this person has, their body is working.
That's right. They've done hard things. They've done hard things, right? They've worked hard. That's what that means. Strong hands, right? How many farmers, how many mechanics, how many people who have worked hard but have never lifted weights, but they've still developed as a byproduct of their occupation a base level of strength that they probably didn't even know correlated with depression. And then later you look back and say, you know what? What we're seeing is someone who works hard, hard physical labor, works hard with their hands, works hard with their body, there is clearly a correlation here.
Yep. Okay, the next big point we wanted to look at is high intensity interval training better than moderate continuous training? So is it better to do more bursts of sprints compared to like just, I'm going to jump on the treadmill for 20 minutes and go at a steady state? And so there's a bunch of studies that looked at this. Kyle, take it off with the first one.
So the first one we're going to talk about is a randomized controlled trial of 59 inpatients. So they're in an inpatient facility with major depressive disorder. They found sprint interval training comparable to continuous aerobic training on reducing depressive symptoms with a large effect size of 1.1. The study also found improvements in VO2 max were predictive of improvements in depressive symptoms. And when you compare the two, the net training load of sprint interval training was 12.5 minutes compared to 20 minutes of continuous aerobic training.
Yeah, so they found gains, like how much the total gains was significantly associated with the decrease in the depressive symptoms.
Yeah.
Okay.
1.1.
1.1
That's
effect
huge.
size. That's pretty good.
And remember, for how long of training? 12 and a half minutes.
12 and
So
a half
when you
minutes.
start talking about bang for your buck, an effect size of 1.1 for 12 and a half minutes, like somebody's going to have to convince me why we shouldn't be doing that. Everyone has time to do that. So that's a fantastic study.
Yeah, yeah. Okay. Tell me about the systemic review and the meta-analysis of high-intensity interval training for severe mental illness.
So this looked at 9 articles on high-intensity interval training for people with severe mental illness. And of these, 7 studies examined high-intensity interval training on mood or on a major depressive disorder. And they found a significant improvement in the mood of 0.641 following high-intensity interval training. And also, of the studies examined, 4 of these randomized controlled trials compared high-intensity interval training to moderate continuous training as the control condition. And they found moderate improvement in favor of high-intensity interval training compared to the moderate continuous training for increased mood.
So it favored high-intensity interval training, is what you're saying?
Yes.
Okay.
So the next study we're going to look at is a randomized controlled trial of 34 inpatients with major depressive disorder, comparing high-intensity interval training to moderate continuous training on depression severity and arterial stiffness, and showed high-intensity interval training had a effect size of 1.48 and was more effective at reducing depression severity than moderate continuous training of 1.4. But they also found that the moderate continuous training was more effective in additionally lowering peripheral artery stiffness. I think this is like diastolic blood pressure. The study only lasted 4 weeks with 12 training sessions.
12 training sessions, and look at that, a huge improvement. Okay, so tell me about this, Kyle. Tell me about the systemic review and meta-analysis of high-intensity interval training.
So this review looked at 12 interventional studies, and they found high-intensity interval training reduced depression severity using the pre- and post measures with a effect size of 1.36.
Yeah, so to conclude, it looks like from all these studies looking at high-intensity interval training compared to continuous moderate training, both have value, but the high-intensity interval training, I think, is a little bit better. Would you say that would make sense?
I would say it's better. Like the net training time is less. So I think it compared to moderate continuous training, high-intensity interval training is the way forward.
Okay, and the next thing I wanted to look at is, what about high-intensity interval training and strength training? So when you combine those things, what we found was that a lot of the studies pointed at both of them working together synergistically. So briefly tell me kind of some highlights of these 3 studies you looked at here.
So in one, it's a large population study of over 17,000 adults, and it found the combination of aerobic and muscle strengthening exercise was associated with the lowest likelihood of reporting depressive symptoms, followed by aerobic only and muscle strengthening only.
Okay. And then this other meta-analysis showed that combined aerobic and strength training, they looked at 17 studies. They showed that it increased peripheral brain-derived neurotrophic factor. Have you ever heard of that one, Matt? Brain-derived neurotrophic factor?
I mean, I think I could. That sounds like a supplement that companies make.
Sounds like a supplement. No, you can't get that one unless you work hard. So basically, they found that low to moderate aerobic exercise did not increase something called BDNF, but the combined aerobic and strength training did increase it. And we're going to talk about that in a second and what that is. But basically, it's like miracle grow for the brain. So there's these studies of cognitive decline in elderly people, and they found that strength training decreases or halts the cognitive decline, like the percentage of the brain that sort of goes away every year, you know, that like naturally it goes away. And so I think it probably has to do with this brain-derived neurotrophic factor. That's probably one of the reasons why there's this sort of halting of brain loss. Okay.
Super interesting.
So one final study here showed that...
This was a cross-sectional study of over 5,000 Australian women, and found that a combination of resistance training and aerobic exercise yielded lower probabilities for depression compared to aerobic alone. And the relative risk ratio was 0.61.
So the reason why I think this is so important, because so many psychiatrists, so many, mental health professionals, we stop at like, okay, great, the person's doing some jogging. But what I think the data says is strength training is so, so important. I just want to I want to get to kind of the heart of, there's a lot more in this document. And so if you guys want to look at the data, we've cited everything. This will be on the website. We go into brain-derived neurotrophic factor, how it's miracle grow for the brain, how it's going to be good for, you. We go into, all of the different other good things that strength training does. For example, it's good for bone health. It's good for sexual health. Even in people, interesting, we found one study, Matt, where people had, they had prostate cancer. And so they needed to be on an androgen blocker. And that's like death to testosterone for men.
Right. It's the opposite.
And it's really bad.
Yeah, that's right. The opposite really of testosterone.
Yeah. And they found that strength training actually got their sexual function up. So it's probably more than just pure testosterone that it's increasing. It's probably increasing a lot of other good things for your sexual health. It's good for cardiovascular health, weight loss. They found that aerobic training alone was not as good as aerobic training and resistance training for fat loss.
Yep. And
diabetes prevention, there was a big study that looked at how there was a 60% reduction in diabetes type 2, which is, practically an epidemic of older people in America.
Absolutely.
And specifically in our patient population, if patients have like schizophrenia and they're on an antipsychotic, it increases the risk of diabetes. And so I try to get them on strength training regimens so that they have a decreased risk of developing it. Okay, tell me about the rate of injury in weight training, because someone's going to say, wait, but it's really dangerous. It causes a lot of injuries.
That's right.
So what did you find?
So when I was looking this up, I actually thought it was going to be higher and more comparable to a contact sport, but it was completely the opposite. So a systematic review in 2017 looked at the risk of injury in weightlifting, and they found it to be around 3 injuries per 1,000 hours of training. And when you look at powerlifting, it was also around 3 injuries per 1,000 hours of training, which is comparable to other non-contact sports. And when we look at contact sports like American-style football, it's 9.6 injuries to 1,000 hours of training. And when you look at competitive soccer, it's 53 injuries for every 1,000 hours of training.
Okay, so basically
25x. Soccer is 25x more dangerous than weight training.
It's crazy.
Now, and also, here's a really important note. That study, which we quote quite often at Barbell Logic and in our marketing data and whatnot, especially when we're working with insurance companies and whatnot, right, is that remember that we're talking about weightlifting as a sport, powerlifting as a sport. And that is not even the same thing as what we're trying to do here, which is to get people generally strong, right? So it would be the same thing as, think about soccer. You can go out for exercise and kick the soccer ball around in your backyard with no one else for fun to get your heart rate up. What would the injury rate be for that? Probably very low. The injury rate that is quoted there for soccer is when you're actually playing competitive soccer. The very nature of competition will make the thing, because we're wired to be competitive, right? We're going to try a little harder. There are other people involved that you could get hurt, or you will get hurt more often. Weightlifting is no different. When someone is literally trying to squat the most weight they possibly can for a single rep in front of a large audience and judges, obviously the injury rate was going to go up there. But that's not what we're even asking people to do. We're just saying, hey, we want to figure out how to strength train to get generally strong, which is actually going to reduce that injury. So an injury rate that is already low among the competitive weightlifters is going to be even lower for the average person who's doing this for general strength training.
That's a really good point. And I think the other thing is, with looking at that last set when someone's squatting and deadlifting, a lot of the times you're looking at, is the technique starting to fade?
That's right.
And so I think the injuries happen when you get to a place where your technique is not good and you're lifting heavy. But what would happen is, as my technique starts to sort of get worse, Matt would decrease my weight 20%, and then, or I don't know, 20% is probably not exact.
No, it's about right. Maybe 10,
10%. And then what he would do is he would focus on my technique, and then we'd slowly pick up the weight again.
That's right.
And so, okay, we have gotten through the studies, and now I would like to kind of get into some of the practical aspects of, like, okay, how do we start? So this is what you've been waiting for, Matt.
All right. Taking the bridle off.
So, okay, let's say let's start with this basic idea of, you create a stress that's big enough to cause an adaptation.
Yep. It's the stress recovery adaptation syndrome, right? There's a stress that you have to expose your body to that it's not used to. And as long as it's not so great, as long as it's not so much that it kills you, which it shouldn't be, then your body will adapt to that stress. It's that simple.
Yeah. And I think a lot of people, if they did exercise back in the day, and that now they've been out of exercise for a long time, they want to go hard.
Yep.
And so they end up like going out on the weekend, slaying themselves, and then they're out for like 6 days.
Yeah. Because they're so sore. They can't move. They can't sit on the toilet.
Yep.
That's a real bad place to be.
So I had this one guy, for example, very, very depressed, was in the military, used to squat very heavy. And so I said, I literally want you to start with like a third of what you used to do. Do 3 sets of 5. And then I'm only letting you go up 5 pounds each time you do it. And you can work out every other day. And so he started slow, and he's like, I really want to throw on an extra 25 pounds the second time I do it. And I'm like, no, you have to start slow. You have to just incrementally go up.
He could have done that weight. He could have thrown 25 more pounds on. But the risk was not worth the reward. Doing 25 pounds less is still more stress than what he's used to. And so it will still cause the desired adaptation. It's the same, I'm telling you, it's the same thing as medication. And when we start to look at exercise and strength training as medicine, then the goal is the minimum effective dose. Why would you take the maximum dose? At some point, you get to a minimum toxic dose, right? Like, why would we even play there? Let's do the minimum effective dose for the desired adaptation, adapt, and then go up just a little bit, add a little more stress each time. That makes far more sense, and it's far safer.
Right. So just to give you an idea, when recently I started some of that high intensity interval training with Matt, and he had me on the rowing machine. And I used to row in college. And when I used to row in college, we would do 3 20-minute pieces as like a normal workout. And Matt had me do 3 or 4. He started me off with 3 sprints, about 12 seconds each.
Yeah, 100 meters.
100 meters on the rowing.
For 3 rounds with, what I give you, 60 seconds or 90 seconds rest between them?
60 seconds rest.
Okay, so that means the whole workout was 4 minutes.
Yep. For that part of it, I was also squatting and deadlifting.
Yeah, for that, that's right, for the high intensity interval training.
And then, 4 days later, we did 4 12-second pieces, and then he had me do 3 24-second pieces, and then he had me do 4 20-second pieces, and then he had me do 1 1-minute piece, and then he had me go back and start doing 6 12-second pieces, and then
that's right.
And then go up to 5 20-second pieces. Now, the reason why I'm giving this example is because most people are starting thinking, I have to go do something that's so psychologically hard, and it's just not necessary.
That's right. You think about the person, you're talking about one of your patients who basically lays in bed all day. What's step 1 for that person? Probably walking to the mailbox and walking back in. Or right? I mean, it's just like
right.
You start conservative, and then the next day you walk down to your neighbor's mailbox and back, and then and you add a little bit every time. That concept is called progression, and we utilize progression in strength training and in energy systems training, which is what HIIT is doing. What high intensity we're training the energy systems of the body, and so we start very conservatively. Mm-hmm. And we add a little bit at a time. And where that conservative piece is for the 75-year-old is going to be different than where it is for the 18-year-old kid who is still in the middle of playing high school athletics. Like their start point will be different, but it will all be conservative at the beginning and slowly add a little bit each session over time.
Yep.
That's key.
I've had a number of people who I will see, and they'll come in with their loved one, and they're on a wheelchair. They might have been in the hospital for 6 months. They had severe sarcopenia, and they can barely get out of the wheelchair. So they're basically pushed around. And what I would do with them is I would grab them underneath the armpits, and I would have them squat out of their wheelchair to see how strong they are and how much I would need to help. And this one person in particular could do about half of it, right?
Yep.
So the reason why they couldn't stand up on their own is because their arms aren't strong enough, their legs aren't strong enough to get out of the chair. What then I did was I taught their loved one to basically help them squat. And I said, you're going to do 2 of these. You're going to wait 5 minutes. You're going to do 2 of them. You're going to wait 5 minutes. You're going to do 2 of them.
That's right.
And you're going to do that every other day. And I've had a number of these people, after about 3 months, they can now squat out of the chair 5 times without any help.
That's right.
And when you can squat 5 times out of a chair without any help, you can now walk.
That's right. That's right.
And so literally, like, we've had people come in. It's this day treatment program that I run. They do a lot of therapy, but I get them to squat as well. And by the end of the program, they're walking out and they are just ecstatic. They're so happy because their life just changed.
Sure.
Yep.
So when we think about, let me ask you a question. So with this episode being focused primarily on the effects of strength training and energy systems training or conditioning on depression, with the aggregate data of most of your clients, would you say that most of your clients who struggle with depression, though, would be a little more in middle of the bell curve for physical ability? Could most of them stand up out of a chair on their own on day one? I would assume the answer is yes, but I want to make sure.
Yeah.
Okay.
I think I'm starting this from the very bottom because I think that's like once you understand that a 70-year-old woman who's been chair-bound can do something that would potentially get her to a place where she could walk.
That's right. And by the way, we have these stories all over the place with coaching. So I have a lady that one of my favorite clients. She is now 84 years old When she came to me, she was 79. She'd been a widow for about 8 years at the time. Her kids all lived in the Pacific Northwest and away from here, and she had a big 2-story house, and she hadn't even been up the stairs in the 2-story house in a couple years. She had double hip replacements, a knee replacement, 2 inches cut off of one of her Achilles tendons. The vast majority of her back had been fused together. I mean, she was just, she was like the bionic woman, the $6 million woman. Now, this all happened before I met her, right? 79. What did I teach her how to do? I taught her how to stand up out of her kitchen chair on her own on day 1. And we added a little bit every single day from there. And now she's 84 and she deadlifts. She picks a barbell up off the floor with 155 pounds for sets of 5. And she has never had an injury in the 5 years that I've trained her. She was struggling to get on and off the toilet. She was struggling to get in and out of the car. Her brain was super sharp. She told great stories. She had an incredible memory, but her physical body was failing her. And now she squats, she presses, she deadlifts. Now she doesn't squat with a barbell on her back. She's 84 years old and she's kyphotic and but she does do goblet squats. She sits on a box and she holds a medicine ball. But she can pick up a barbell with weights on it off the floor. She can do that, no problem, right? So she's done those things very slowly over the course of a 4 or 5 year period, and it has completely changed the quality of her life. She bought a little sports car. She's completely independent. I mean, look, for her, when you struggle to get off the toilet, the next stop is the nursing home. That's it. And now she has no problem, obviously, walking up the stairs, going to the second story of the house, getting in the little sporty coupe she bought, deadlifting, getting around, walking around, the grocery store. I mean, it's just no problem at all. So she is now strong enough to do anything that life would throw at her. And this is a lady in her 80s with all those surgeries.
And now she also has reserves.
That's right.
She has reserves. Like if something hit her, if for some reason she ends up sick or something, she has some reserves. And, people who have sarcopenia do not have reserves.
That's exactly right.
So it's kind of like your 401k,
It's exactly like your 401k.
It's like you're putting money in the bank slowly over years, and then at some point you need to cash out. And the other thing about strength is once you're strong, you can get back to being strong a whole lot faster.
That's right. Well, strength takes the longest of all the physical abilities. It takes the longest to build, but it also takes it's the slowest to lose, right? Whereas cardiovascular, like VO2 max, you can actually get a very healthy, very competitive VO2 max in a short period of time. But if you go on vacation to Mexico for 2 weeks and drink margaritas in the swimming pool, and you come back, your VO2 max is not very. It's going to take a little bit to get it back up to par, right? So strength is it takes a long time to gain and a long time to lose. Whereas those energy systems training they're quickly gained and quickly lost. And you talk about that time period where she's built up that 401k, that physical 401k. She has had to, unfortunately, deal with that here in 2020 with COVID. She's 84 years old. She can't go out and train around people at 84 years old. But she had built up this great base of strength that now she's prepared herself so that in a time where she now has to make withdrawals out of that 401k, there's enough of a balance there that it doesn't throw her into illness. She's fine. Right? Yep. And we're very close, probably, to bringing her back in and having her train with the barbells again. But because of her demographic, she can't go out and she's just sort of homebound right now. And she's doing stuff at home the best she can. And, she's walking the stairs as often as she can. She's doing those things. But you're exactly right. It is exactly like a 401k. You make deposits when you can. So when the day comes when you have to make the withdrawals, you had already paid your dues and it doesn't throw you in. So her bone density numbers are incredible, right? Mm-hmm. She doesn't have sarcopenia at 84. She's built muscle from 79 to 84 as a female, which on no hormones, which most doctors would say is essentially impossible. It's not. We've watched it happen over and over and over again.
Yeah, there's a myth out there that you can't get stronger once you pass a certain age, and it's just not true.
Right. It's
just absolutely not true. My critique of physical therapy, because often physicians will be like, oh, I'll just send them to physical therapy, is they do bands, they do, like, I had this one patient, broke my heart. They were having him squat twice a day, like sets of 10. And I was like, that's just too much. So one of the things that I've learned from you is, like, when you first start out, if you're older, twice a week is probably where you want to be. And if you're younger, maybe 3 times a week, but that's about as much as you can put.
That's right.
On your body.
That's right. Would it be okay with you for a second if I go, let's talk through like what those kind of big picture items are for how to get started for the average person?
Okay, let's do it.
Here's the way I look at it from a logical kind of the way my brain works. So the first thing we have to think about is if someone goes to the gym, especially like a big box type gym, there's an infinite number of exercises that they can do, right? There are hundreds of machines, and if they don't know where to start, what would you possibly, like, where do you go, And so we have an exercise selection criteria that we use. And it's because we want to think about, what's going to get us the biggest bang for our buck. But so you take this infinite number of exercises and you can apply some criteria to it, right? And that criteria that we use for exercise selection is we try to find exercises or choose exercises that use the most muscle mass. And an easier way to say that is we want to find exercises that make the most joints move, bend, and straighten, right? Because that's what muscles do. And so you start thinking about, well, I could do a 1-arm dumbbell curl where only my elbow bends, and that's not working very much. So I got to do a whole bunch of exercises to work my whole body if I'm doing things that are single joint exercises. The body is made to work it's a system, it's systemic, right? It's an organism. It's not meant to take the bicep out and just do the thing. We're made to work together. And so we try to pick exercises that use the most muscle mass. We try to pick exercises that we can train over the greatest effective range of motion. We want to move through that full range of motion. It's healthy. It's good for mobility. It's good for agility. It's good for flexibility. People that do strength training correctly, the vast majority of them will never have to do things like yoga. And I'm not saying yoga's bad. Yoga's great. But your mobility is enough because you are doing full range of motion squats. You're doing full range of motion presses. You're working those joints through the full safe range of motion, right? And lastly, and this is the one that's sort of like, is if strength training is the goal, then we want to choose exercises that will allow us over time to titrate up a little bit at a time and use the most weight. Because strength training, and maybe it's clear or important to say this, strength training is literally defined as being able to produce force. And the person who can produce the most force is the strongest. So what we're trying to do in strength training is learn how to produce more force. Mm-hmm. Now, if you're that person that now walks into that big box gym with the hundreds of exercise machines and hundreds of cardio machines, you don't know where to start, and you apply those basic criteria, and we've done this for decades now, we literally get down to 4 or 5 exercises. We get the squat, which is literally like sitting down and standing back up. It's a sit to stand. We get the deadlift, which is picking stuff up off the floor. We get an overhead press, which is exactly what it sounds like. You press things overhead. And we get the bench press, which everybody knows. It's the one you lay down on the bench press, right? You lay down on the bench and you press vertically while laying horizontally. And that literally works the entire body. Really, the only thing that potentially is left out is some of the muscles of the upper back. And to train those, we do chin-ups. Or if someone is unable to do chin-ups, then we can do that machine at the gym that they call the lat pull-down machine. And literally those 5 exercises will train every single muscle in your body. And even for those competitive powerlifters, competitive weightlifters who are at the absolute top of their game, 95% of everything they do in their entire career will be those 5 exercises. yes, they'll do a few extra things because they're competitive here and there. But for the average person who's just trying to get generally strong, that's literally all they need. And so it's very, very simple.
Yeah. Yep. So I started, once I figured this out, it was, I think about 3 years ago, I started squatting, so for me, it was about the barbell, which is 45 pounds and 45 pounds on each side. So it's 135.
Yep.
3 sets of 5.
And by the way, I think most people who listen to you know, I mean, you've got a big frame on you. You're like 8'2" and like 430 pounds. You're built like a world's strongest man. Like if you had decided not to be a psychiatrist, you could have been the world's strongest man based on your frame.
I don't know about that.
Well, you know what I mean. I'm exaggerating, but you're a big
funny
guy. So 135 to start with is that's far on the right side of the bell curve. No, I think that's important for people to understand. We made this point earlier. It is perfectly okay to not even be strong enough to start with the empty barbell and to work up to an empty barbell, right? You're a big guy. What are you, 6 what?
Well, so I'm 6'5". When I started, I was about 260. And, I was a competitive rower in college. So I rowed at, one of the top 3 programs in the nation for 4 years, which is, a lot of legs. It's not just arms, in case you've never seen rowing. And, a lot of the people who rowed with me had already been in the Olympics or were eventually in the Olympics. Yep. So this was like an elite level group. If I wouldn't have gone to medical school, I could have, gone out to the national team. And if I would have slaved away for 4 years, I would have been in the Olympics, right? So that was kind of the level of the training that I was doing.
Well, and we still started you with those same 4 exercises at a pretty conservative weight that was conservative for you. And we slowly added a little bit over time and got you stronger and stronger and stronger for you. And again, it's not about you versus somebody else. You're not a competitive lifter. You're doing this for the quality of life and health benefits. That's why you do this.
Yep.
So one of the other things I think is really important to think about for the practitioners that listen to this podcast is I think it requires a paradigm shift to think about strength training and conditioning as medicine. Right. And so when we think about the medicine criteria that you would use, and let me be very clear, I am a strength coach. I am not a doctor. So if I say something here that you please jump in. But from what I understand, and also from what we have a lot of doctors that work for us as strength coaches at Barbell Logic Online Coaching. And one of my favorites, his name is Dr. Jonathan Sullivan. Little plug for our podcast. We're about to come out with a series on barbells and health, strength and health. And he wrote a book called The Barbell Prescription. He was a emergency surgeon for like 30 years, and he's a fantastic strength coach. And he started to see this problem for years and years. Everyone that came into, the vast majority that came into the emergency room, was what he called the sick aging phenotype. It was that, they'd come in for this thing, but they were all overweight. They had blood sugar problems. They were hypertensive. Their cholesterol was high, right? What we now call metabolic syndrome, which wasn't the case back then. Like 90% of the people that came in would have that thing. And he was trying to figure out what was going on. And so over time, he developed this medicine criteria specifically for exercise. And it's the same criteria that you would use for pharmaceuticals. And it's this: any medicine that we prescribe should be safe as it can be. And we've already discussed, based on the data, that weightlifting, that strength training is incredibly safe. You don't want to hurt people. That would defeat the purpose. So it must be safe. It needs to have a wide therapeutic window, right? The range between the minimum effective dose and the minimum toxic dose needs to be really wide. Like drugs that you increase by a little bit and potentially kill people, that's a very dangerous drug to take, right? It's not very safe. And strength training allows us to titrate up from literally nothing, from literally a PVC pipe to a child's aluminum barbell, to a slightly heavier barbell, to as much weight as you could possibly eventually, the world champion weightlifters, the kind of things, they 1,000 pounds, 800 pounds, which is not what we're telling your listeners to lift, right? But it has a very wide range of a therapeutic window. It's comprehensive, right? I want something that has a comprehensive effect. I want a wide range of effects. If all strength training does is make me strong, and it doesn't change. It doesn't have this effect on depression. It doesn't have this effect on sarcopenia. It doesn't have this effect on bone density. What's amazing about strength training is its effects are so incredibly wide-ranging.
Yep.
It makes it a wonderful medicine, right? And the last two is that it is specific and effective. And really there, we know that what's really interesting about all those studies that we read at the beginning is they would use these terms, resistance training. And often when you look at the resistance training they do, it's not even very good, but any resistance training seems to work significantly better than no resistance training. And what I think we do well, and the reason I hope that you've had me on the show is because we think we have found over decades the most effective way to do this and the most specific way to do this. And lastly, the simplest. That should be simple and efficient. And so people are busy. Your patients cannot train 3 hours a day, 6 days a week. They're not professional athletes. And what we found is when you read through these studies, literally things like 30 minutes 3 times a week gets this incredible bang for your buck. And that's why strength training is so amazing, because it fulfills all of that medicine criteria that the practitioners are already using for pharmaceuticals. Only we don't have to take anything exogenously. We can actually do this on our own and have an incredible impact. And that's pretty amazing.
Yep. And so just to give people an idea what we're talking about, if you add 5 pounds to the bar 3 times a week, you're going up 60 pounds a month.
That's right.
And so for the first 4 months, I was able to continue that until I got around a 300 squat, 300 deadlift. And I kind of continued in that area for about 2 years until you became my trainer. And
Coach,
through your coaching and programming, my squat went up to about 380. Now we've dialed me down quite a bit because I wasn't going deep enough. So there's like this kind of balance of technique and strength. And I think for me, because I'm not a competitive strength trainer, I'm doing this for, longevity and for total brain function, for optimizing, all the good hormones that I want optimized without adding any hormones to myself.
That's right.
We're a little bit more on the,
conservative side. You're not chasing numbers. You don't have to chase numbers.
Yeah, I do actually want to start rowing again and maybe competing. I want to talk to you about that eventually. But the idea is that, I was already an athlete, right? So I trained a guy out of my garage who had never been an athlete, never done any sports, and he got up squatting around 155. He was deadlifting around 225, and he has like a body type of someone who, if you looked at him when he first started, you would be like, this guy has never done anything physical in his life, And so what's amazing to me is how fast people can get strong with the proper coaching and with the proper model. And
that's right.
If you're listening to this and you're like, that's like a lot of weight, I don't know if I'd ever want to do that. That's fine. I mean, my wife started doing this. She's being coached, and she was squatting a bar, 45 pounds. She played tennis in college, and now she's doing, maybe like 105 pounds, 120, and she's got good technique, which honestly, it's taken her 4 or 5 months to get the good technique, to get into a place where it looks good. But what the benefit of that is that, her bones are going to be stronger. She's going to be more resistant to different medical issues. So, yeah, I just want to throw that out there.
Well, and even somebody like you or like your wife or, most of our clients who don't necessarily come in depressed will train and will, after 3 months, notice a marked improvement in social, emotional, mental well-being. This is not a meta-analysis. This is Matt Reynolds, who has trained thousands of people. They didn't necessarily notice that there was an issue in the first place. They just go, wow, I feel more confident. I feel better. I feel like my quality of life is better. I carry myself a little bit different. And we're not talking about, just be clear, we're not talking about arrogant bodybuilders. We're not talking about people who lift just to look good. We're talking about who train to be healthy. And then they look back and they go, wow, what I have found, what we've coined the term in our business and our podcast of voluntary hardship. When people walk through this fire of voluntary hardship, they notice that they are refined by it. You don't have to lift weights. What? Wait, that's not the same thing as going to war. It's not the same thing as being pushed into involuntary. Involuntary hardship is different, and it refines some people and it crushes other people, right? But voluntary hardship, when I choose to do hard things on my own, I take personal responsibility to do it. Even for people who don't have depression and aren't wired for those things, or even like for me, because I can speak about myself, like I'm wired for some anxiety. Training is an incredible medicine for me for that. I train and I am less anxious. I train and I feel better. I train and I carry myself better. I train and I'm more confident. I'm trained and I feel better about talking on a podcast. These are the benefits that I never thought about when I started. I just did it because I wanted to get big and strong because I was a college kid and wanted to get big and strong. Now I do it for health. And it's been incredible.
Yeah, the confidence, it's interesting how launching my own podcast coincided with having about 2 months of strength training.
Yes.
Because I had been sitting on the gear for about 2 years and had different ideas on what I would do. And, I do think it improves your confidence because it does affect things like testosterone. It does affect, your stress, how you handle stress. One of the biggest psychological things that I'm thinking that strength training can do for someone is it creates not only a physical stress, but a psychological stress. So the stress system in our body, physical stress and psychological stress are, the same hormones, cortisol,
That's right.
Norepinephrine, like epinephrine, like all of this is released every time you have a stress. And so what's happened in our culture is a lot of people can go months and months without having a stress. And so then the stresses that are small start to become big stresses. And so what I see with a sequential program, with the voluntary hardship that you have to go under to do it right, because honestly, it is hard sometimes. Like sometimes I don't want to, squat, especially when it's like getting pretty heavy. What it does is it creates a stress, and that stress allows my body to learn how to deal with stress better.
That's right. It's what we found is that when you spend time doing these hard things that nobody else makes you do, that you choose to do, strength training is a wonderful, and we haven't really even talked about the high intensity interval training, which is also really, really, really hard and not very fun. And your heart gets racing like crazy. It's called high intensity because your heart rate gets up, 90% of its maximum capacity. It's pretty intense as well. When you do those things, it's interesting. It's not that it makes these things not painful, but when you get laid off from your job, when you deal with a year like 2020 where we've had COVID and all sorts of upheaval in the United States and people are struggling financially and the economy is crashing, when someone gets sick, when you lose your parent, you're a little better prepared to handle those big involuntary stresses when you have forced yourself to go through the voluntary stressors. That's what we found. And by the way, there isn't a study on that. There is no metadata on that. Yet we know out of the years, the decades that we've done this, that it is the case. And we know it personally. You know it because you've done it. I know it because I've done it. I have coached thousands of people. I've watched them report that in the testimonials of people. They see that as a massive positive impact of strength training.
Yeah. Well, I mean, I think that the data showing that it decreases the future incidence of depression is showing that.
That's probably a good point. Yeah.
Because when you have a multitude of stresses, that usually can trigger someone into a depression, if they're wired that way. And, for myself, I get first migraines. That's probably the first thing that hits me when the COVID hit and I was doing 100% video calls. After about a month, I started to get headaches pretty frequently. And that's about the time where I reached out and was like, hey, I want you to be my coach. And now I have maybe one every like 3 weeks. So it's pretty infrequent compared to where it was, and, I have a lot of stressors in my life that kind of fluctuate in and out. But I do think that there's something about sort of progressing, getting stronger, that influences the overall way that we metabolize stress. And so with every patient that I have, every patient's going to have stress. So I want all of my patients squatting. It was a joke for a while because I was literally like getting every patient to squat, and I was showing them how to squat, in the office. Yeah. And some of the residents who don't understand this philosophy was like, what is he doing? They just didn't understand how important it was. and I would try to convince them and talk to them about it. And so I'm glad we can do a long form so that I can say, hey, listen to this podcast because this will explain.
That's right.
Explain my thought process.
I'll put you on the spot here for a second. For me, strength training is hard, right? Let's be clear. This is a hard thing. It doesn't have to start that way. It starts conservative, but over time it's going to get hard. That's why we call it voluntary hardship. It will get hard. It has to be hard to make you better, to actually get that adaptation. And hard for some people, sometimes some people aren't cut out. They just won't do hard. Okay. But for me, my experience is that for far greater than 99% of my clients who have bought into strength training for at least 6 weeks, none of them would ever come back and say, that was a bad move for me. I wish I had not done that. It just seems like everyone that does it if you'll give it 4 to 6 weeks, it'll change your life. Mm-hmm. That's all there is to it. Is your experience similar?
Yeah, I think, I obviously have kept with it. A couple years ago, I bought all the gear to be able to do it out of my garage. And it's helpful too when you have small kids because I don't have to go to the gym.
That's right.
I don't have to deal with all of the gym politics or people looking at me funny or, waiting for someone to get done with the squat rack. So I've always done it out of my house, and it allows me to, do it while my kids are sleeping. So there's a positive there. And I think that although it's hard sometimes, it's like I'm progressing. I'm still making gains, and it's been 3 years. Like now we're doing more rowing and high intensity interval training with the rowing. And there's something exciting about getting back on that. It's not fun all the time. Honestly, it's really hard, and it's psychologically hard to get on the rowing device by myself in the garage late at night. If you have rowed, you might know what I'm talking about. Like it would be easier if I was in a group doing this, but unfortunately there are not I have friends who come over and lift with me. That's been really helpful. Rowing groups. Yeah, we're thinking about where we could possibly do that.
What about for your clients? So as you've now prescribed this exercise medicine for certainly scores, if not hundreds of clients. Of the ones, I know there are people that always, because we see it in our own practice all the time. There are people who do it for a week, 10 days, and they're just like, I just can't do this. This is too hard, right? And I understand. But for the people who have done it, for your clients, just aggregate, who have done it for 4 to 6 weeks plus, how many of them or what percentage have come back and say, I really wish you had never had me do this. I feel like this has made my life worse as opposed to better.
Yeah. I mean, 100% have said, thank you, right? They get it. They don't honestly, the hardest part is to get them started, to get them going. And so lately, if I can connect them with a coach, it's interesting because I'm in this world. I know coaches in different states and different cities.
Sure.
And so in the midst of COVID, I've had a number of patients who are not in my area. I do some long distance stuff, and I have connected them with someone who came to their house.
Right.
I have this 80-year-old lady who now a coach comes to her house and works her out, and this is someone who I trust, who I met at a conference, and it's been helpful, and it's literally going to be as big of a piece in my mind as the therapy that I provide once a week.
Absolutely. Sure.
The therapy is going to help them, counter negative narratives that they have, deal with psychological stress. Like, I 100% believe that's important. And the medication, this person's also on medication. I mean, some people are just wired 3 to 4 standard deviations in one direction, right?
Sure. Towards
neuroticism. Like, they've always had anxiety. And so medications might be important, right,
Sure.
for this type of person. But the combination of all of it together really does give the value to a place where that person's life is very changed.
Yeah, that's great.
And so, yeah, I would say 100% who start do not regret.
It's interesting, as you were talking through that, I was thinking through this sort of 3-pronged head of strength training, therapy, and medication. And not all people need all 3, but both therapy and strength training for you and for a good professional, as I would hope most people who are listening to this podcast are, it's sort of low risk, high reward, right? Like therapy, you are a professional at therapy. You can probably have a fairly low risk with therapy. Like, you've learned that same process that I apply to strength training of starting, probably not too intense and slowly working in. I don't know. This is not my skill set, obviously. But the point here is that those two are
100%.
Those two are low risk, high reward. The medication piece is often high reward as well, but it's also much higher risk because you're not especially when you're dealing with hormones, you're not entirely sure, right? It takes a while to figure out what the right combination of medicine is for your patients so that they get the reward that you're looking for, the effect that you're looking for. But the therapy and the strength training, strength training is the simplest, I think, with the lowest risk and a very high reward. I won't say the highest reward, but everybody benefits, right? And the vast majority of people are going to benefit from the therapy. And then the medication is the one that's a little bit more difficult. And it certainly has a great ROI as well once you get it honed in. But it's tough probably at times, I would imagine, to get it honed in.
Yeah, medication, has side effects. And so a lot of people come to me already on medication. The people who come to me on medication may be on, sometimes even 5 or 6 medications. And they don't want to be on 5 or 6 medications, and they're still miserable. And they have sexual side effects of the SSRIs and the SNRIs and, other things. And so, once they're out of depression, it's like, okay, how can I get them to a place where now they don't need to be on as many medications? And one of the things I constantly say to them,
that's right,
is getting a good strength training program will change the amount of medication that you need to be on. And so if I can get someone in strength training and in therapy, they may not even need medications, depending on the severity or what's going on, And so ideally, in my mind, I would much rather use less medications, just because I know, for every 10 people I put on an SSRI, probably about 7 of them are going to have some sexual side effects. And,
sure,
sexual side effects really do lower the quality of life for a lot of people. If they're not able to have an orgasm, have an ejaculation, have a full arousal, full desire, sexual desire, and that impacts their family unit as well. So
that's right.
Yeah, I think that eventually I almost want a gym attached to my practice.
Yeah.
I had someone from Australia reach out. She's probably listening to this. She was like, hey, do you have any best practices on how to have a gym attached to your practice? At this point, I don't, other than the model that you want is probably something close to what you're talking about, and learning a lot from that book you recommended and your buddy who wrote that book.
Barbell Prescription is great.
I recommend that book. That's the one book I will recommend.
Yep. You can get it on Amazon. And again, and just be clear, I don't make $1 off that book. So Barbell Prescription is a wonderful book. I'm also not here to promote my business. I will say this. We went into the big picture pieces of what lifts to do and some of the big picture basics of of the program. But for us at Barbell Logic, our content is always and will always be free. And so for people who are wondering, well, he talked about doing things like squats and deadlifts and presses and bench presses. And I kind of know what that stuff is, but I don't really know. And I don't exactly know how to do it right. And when they talk about the program, like, okay, it's only 3 days a week. All of that stuff we have online. We have a great YouTube channel at Barbell Logic where highly professionally produced videos are very short that are like 3 minutes, 4 minutes long that teach you how to do the lifts, that show you how to do the program. It costs nothing. Right? It costs nothing. You can go and we always want that to be free because we want to expose people to that information so that we can change as many lives as possible.
Yeah. And to be clear, I don't have any financial relationship with Barbell Logic.
That's right.
I'm not making any gains by pushing you that direction. That's where I get my coaching done.
You are a full paying client. Your family pays for coaching at Barbell Logic. So right.
Yeah. But I think what I'm interested in is helping the most people possible. At the end of the day, if you're a therapist, if you're a psychiatrist listening to this, consider starting your own program first, right?
That's right.
See what the benefits are, see what the process is like, because it's going to make a difference. It's going to make an impact in how you feel, And it's another tool in our tool belt. We need as many tools as we can to be able to help the most people possible. And at the end of the day, from the data that I presented, from those studies, we'll link that in the blog. We'll show you, maybe I'll link some of your YouTube videos on like squatting, deadlifting, just to give people an idea on what that looks like. But it does work.
Yeah.
It's hard to get going. I've had a lot of patients who, when I talk to them about it, it takes a couple conversations. It might take like 4 or 5 sessions of me bringing it up for them to actually follow through.
Sure.
And I'm hoping that I can give them this resource as well as a way of saying, hey, check this out, listen to this.
Absolutely.
Understand why I think this is important. Understand some of the basics of what you're doing. You're creating a small stress. You're taking a day off. You're creating another small stress. You're taking a day off. And it could start, I started one patient like, hey, I want you to walk out of your house 5 minutes in one direction and then walk back.
Yep.
And then every day I want you to add 10 seconds to that.
Yep.
It's the same kind of idea. That's a good starting place. It's a progression.
That's right. That's exactly right.
And over weeks, she'll get up to 30 minutes. And then, once she's at 30 minutes, I'll add in a little high intensity interval training. And then eventually I'll have her start, doing some strength training as well to create that extra benefit. Right. And I think it'll make a huge impact. I know it'll make a huge impact.
Yeah.
Hey, is there anything you wanted to mention before we sort of wrap this thing up here? Pearls or big takeaways that you'd want people to have?
Here's what I would say, and I don't want to put words in your mouth, but what I'm hearing you say is that for you and your practice, strength training is as important or is one of these major pieces of importance, along with therapy and medication. And for a lot of practitioners, they're not using it. And if we consider ourselves as practitioners, professionals, and we take pride in what we do, then I think we have a responsibility to learn everything we can about the things that will improve the lives of our patients. This is huge. And so if I'm listening to your podcast and I have earned trust, or you have earned the trust of your listeners, as I'm sure you have for many, and you are talking about this has changed my life and changed the lives of my patients, then I think we have a responsibility as practitioners to do everything we can to research that and learn about it for ourselves, because it can impact the lives. Ultimately, what are we trying to do as practitioners but improve the lives of our patients? And I'm not a doctor. I'm not a psychiatrist, but I am a practitioner. I can't do all 3 of the things that you can do. I can only do one. I can do the strength training part. I can't give therapy. I can't give medication, but I can give strength training, and I'm going to learn everything I can about it. And if there are pieces in my world that will teach me over time as technology progresses and knowledge progresses, that I can continue to learn so that I can change the lives of my clients for the better, certainly the bell curve there, then I think I have a responsibility to do that. And I think it's the same for people in your profession.
It's interesting. We spend, by the time you graduate medical school, you've probably spent about 10,000 hours learning. By the time you graduate residency, you probably spend another 10,000 hours. And And yet, this is something that probably for some people is completely new. Like maybe they thought, walking or cardio, right? But strength training, increasing strength, it's something that's new. And so I would say, how many hours have we spent learning about these other things? And what if you spent, 10 hours, just even 10 hours learning about the importance of strength training? Maybe even just 1 hour, just jump on my blog, read the actual, like what we've written about this. It's going to be kind of a summary of what we've talked about here. We'll cite the studies. You can look at those studies. You can come to your own conclusions on what the best practices are. And so we spend 20,000 hours learning about everything but strength training.
That's right.
So maybe spend 10 over the next month or so jumping on my podcast. I'll try to link some of the key information on where to start. I have a couple other episodes on strength training. I have written a couple articles on this stuff already, looking at the cognitive function, looking at depression, and maybe get a book. The book I recommend, this strength training book by this other doctor guy. So I'm excited for you guys to kind of consider this as an option. I think it's going to really change the way that you feel. It's like I'm going to do an episode actually, Reynolds, on how to retire well with financially specifically. We've done one retirement psychologically. I'm going to talk about like how I invest my money in a way that's very simple. It takes 4 hours a year of work, 4 hours a year, and it has a huge impact because of compounding interest.
Sure.
And there's so much financial information out there that's just complete fluff, people wanting to make money on you. So I'm going to give you sort of what I found from about 20 books of reading and maybe, all the work that I've done. And in the same way, I think strength training is like, do you want the best physical health when you're 70 years old? Like,
right.
Have a strength training regimen, invest some money in yourself, just like you would any other place to just be in a better place. Okay.
And it's not that complicated. It's just like your financial piece, right? So people that try to make money off of others in the financial realm, just like in the fitness realm, one of the things that becomes very attractive is if I can make it very complicated, they have to continue to pay me because they'll never figure it out. It's complicated. But the reality is that learning how to live financially free and build wealth is actually not complicated. And learning how to live physically free and strong and improve your physical quality of life is also not complicated. Neither are easy. It's hard, but it's simple, right? It requires some effort, but it's not very complicated. And so I think that's why there's so many charlatans in both of those industries.
Yep. Well, I mean, everyone wants to say that their way is the only way of doing it.
Sure.
And everyone wants to, the financial world is a world largely of salesmen.
That's right.
And so is the fitness world.
That's right.
So when I did my research, which eventually led me to you, like I didn't start with you. I was doing a lot of digging. I was reading everything. I was, pursuing this for a while. It's been a journey. So I'm trying to give the best information that I can find possible, put it out there. Hey, start where where all my sort of research has led me. Kyle, I'm over here. I'm thinking, what is Kyle thinking as we're going through this? You haven't spoken for a long time. Is any of this new for you, or is this kind of like?
Yeah, I was like thinking back on my own strength training, like early college. I was doing like deadlift, squat, bench, and I was doing like 6x6, and I was just so sore when I went home, like the next day, like you said, like just in pain, like sitting on the toilet. I'm like, how much time have I wasted?
Yeah.
I want to give the slow progression.
That's right.
I'm excited to try that, once the gyms open up after COVID. But
you can come hang out in my gym.
Sounds good.
I'll get you started.
6x6 is like the person that eats 7 ibuprofen.
Yeah.
That's what it is.
That's a good way to explain it. Yeah.
But you don't have to have 7 ibuprofen. 1 will work usually in the beginning. And then when it, eventually you'll go to 2, like it's minimum effective dose. And sometimes 6x6 works. But the question is, if 2x5 or 3x5 also work? Why would you do 6x6? That sounds terrible. I don't want to do that.
Yeah.
Right. That's the key.
You don't want to do that.
If one ibuprofen works, why would I eat 7? That's terrible idea.
And it can be counterproductive to actually overstress your body.
Absolutely.
Right. So just having, 3 sets of 5, I think is sufficient for most people to get to a really good spot where they're pretty strong. It might get more nuanced eventually, but 3 sets of 5 is like a pretty good way of doing it.
Yeah, like we've said it, we've kind of danced around this, Pewter, but it's this. We do 3 sets of 5 repetitions on a lift. So we take the squat, we warm up properly with good technique, and let's say that day we're going to squat 65 pounds, which isn't very much. We're going to do 65 pounds for 5 reps. We're going to wait 3-4 minutes. We're going to do 65 pounds for 5 reps. We're going to wait 3 or 4 minutes. We're going to do 65 pounds for 5 reps. Now we're done squatting. A few days later, when we come back, guess what we're going to do? The same thing, only instead of doing 65 pounds, we're going to do 70 pounds. It's literally that simple. It's literally that simple. That's what you do on the lifts.
Yep.
One other thing I'll say is like after getting more exposure to depressed patients, you talk to them and like they're not really proud of much in their life. But like what Dr. Pewter was saying, like if you add 65 pounds to your squat over a month, that's incredibly powerful. And I think that could have like a psychological effect too of like you're building yourself. You just care about yourself so much.
Yeah.
Like, it shows your self-value.
It's the same thing of like starting to get someone who has not cleaned their house to slowly clean their house. It's like then when their house is clean, their bed is made, things are put in an orderly fashion, it's like they're proud of that. It's like I've created order to the chaos of my life. Strength training creates order to the chaos of our body.
That's exactly right.
It's like we're putting our body through a system that our body doesn't like when it's going through it. Maybe, for a couple minutes of the actual lifting time or a couple minutes of the actual high intensity interval time, but then our body just responds with like producing all of the good things that we want our body to produce, So I had like a patient who was like, should I get on testosterone? And I was like, well, honestly, I think if you lifted weights and you stopped eating junk food and you started sleeping 8 hours a night with that CPAP, I think your testosterone would be radically changed. And it was.
That's right.
It was. He went from like being in the 10th percentile of men to like the 50th percentile.
That's right.
Just by changing lifestyle stuff. So it's like
that medication really just it's you're medicating the symptom. The symptom is he has low testosterone. What's the problem? The problem is he's sedentary. He eats junk. He has sleep apnea, right? He chokes all night long. And as a result, his testosterone is low. What do we tend to do? Right. Treat the testosterone. How about we make a lifestyle change? That will, and almost always, not always, but it's certainly, there is no downside for the lifestyle change. If he makes the lifestyle change and he sleeps better and he eats better and he exercises and his testosterone is still low, you might have then sent him to the doctor to go get that maybe, but most of the time you're probably finding that when you actually attack the root of the problem and not the symptom of the problem, then you get a bigger bang for your buck.
Yeah. Man, I'm thinking a couple surprises I had of getting coached by you is how positive you are. So what Reynolds does is he watches a video of me squatting and then he records a video on his computer of him commenting on my squat. So every morning I wake up to a little video of Reynolds commenting on my squat. And what surprises me is you're usually very positive when you do it. Like I didn't expect the positivity.
Wow. Thanks.
And that's been a nice surprise. It's like, wow, hey, good morning. Good to see you. Okay, let's see this. All right. That one looked good. Okay. That squat was a little bit too high. Oh, you're doing it again. Your squat's a little bit too high. Okay, we gotta figure that out.
You naturally, I think, learn the compliment sandwich. I don't think about it. I mean, I never think about things like that anymore. I've just done it for so many thousands of hours. So you talk to somebody, the key is you're trying to encourage them to keep going. I know it's hard. I've done it. I do it.
Yeah.
It's hard, right? So people and even now, I have been lifting competitively for 24 years, and I still have to work every single day when I squat on my squat form or on my deadlift form. It's not just automatic. It takes work, right? And so I know what it's like to work on those things. And so, yeah, it's important to be encouraging. Now, I do have some clients that sometimes need a talking to, right? They need a little bit of butt chewing. Like they start to do one and they just kind of give up. And you have to have a good, as coaches, we are certainly not psychiatrists, but there's a little bit of that. You've got to read their personality enough to go, I need to figure out if this person needs encouragement to do better on the next session, or a little bit of come to Jesus meeting to do better. Like, hey, that really wasn't heavy. You just stopped trying, right? Sometimes I have to say that to people, but you're somebody that I think you're very self-motivated. And so encouraging you and walking you through the technique changes, that's key. And we've said all along for us, the things that make the biggest impact in strength training are consistency and form. And so if you do this and you don't miss 3 days a week and you make sure that your form is correct, and for you have a coach, then you're 90% of the way there. The program matters far less than just consistency and technique. That's key.
Yeah. Okay. Well, I think we could go on. We'll have to do a part 2 or something.
Love it.
And if people have questions, if people want to know, stuff that maybe we didn't cover, shoot me a DM and we'll make a list of that for part 2. But hey, man, it's been good to see you. And
thank you for having me on the show. It's been a blast.
Yeah, we'll talk soon. Okay?
We're going to come out on our podcast with a best of Dr. Pewter series soon. Seriously. Because now you've been on the show enough. Yeah, it'll be great, right?
Okay.
So, and we'll put it'll be kind of like a rewind series. And then you can send some of your audience and be like, if you want to hear me dive deeper into this strength training, you can listen to the best of Dr. Pewter series on the Barbell Logic podcast. I'm serious.
Nice. Yeah.
We were talking about that the other day.
Once we record that, I'll email out my email list and share that with them.
Awesome. Thanks for having me on the show, sir. I appreciate it.
All right, so yeah, if you want to check out the blog that will go with this, it will have all of the links to get to know Matt more and get to know the studies more, and we'll put some links to the YouTube videos I would recommend watching on technique to get you started. All right, have a good one.